Hi all, good evening and namaste. Today we're going to talk to you in detail about the questions that are asked to us on the topic of rhinoplasty or nose job. So what our staff have done is that we get over 300 patients from across the globe contacting us, asking us all kinds of questions you can ever imagine about any topic, especially on facial cosmetic and facial surgeries. So Dr. Madhu has gone through a lot of these questions and she's picked up the top 50 questions people would like to know their answers for, either before, during or after they've undergone or they plan to undergo a nose job or a rhinoplasty. We're going to go through it fast, so stick around and I'm sure it's going to be useful if you want to know more about nose job or rhinoplasty. Alright, Dr. Madhu.
The first question, is rhinoplasty a cosmetic surgery?
Yes, absolutely. It is a cosmetic surgery pretty much, though some of the functional issues like blocked nose can also be solved.
What is the difference between an open structure and a closed rhinoplasty?
Open structure, small scar here, the whole nose is open. Closed structure, it's not. It really doesn't make a difference. It depends on the skill of the surgeon.
What is atraumatic rhinoplasty?
Atraumatic rhinoplasty is something that I don't think exists at all. Every rhinoplasty is a surgical insult to a patient that needs a while for healing, and so there's nothing really like an atraumatic. You can call it less traumatic or more traumatic, but nothing as an atraumatic.
Will the rhinoplasty results last lifelong?
Absolutely. Most of our rhinoplasty results do last lifelong unless you choose to do the temporary or a filler type of a non-surgical rhinoplasty.
Is rhinoplasty a life-threatening surgery?
Absolutely no. Very common question, because we have a team that takes care of all their medical issues. They run through by the physician, then the anesthesiologist, and then the surgery is done. Hence, not a life-threatening issue at all.
What do you mean by a revision rhinoplasty?
Revision is to do again. So if the patient has already had a nose job and comes to us and then we do it again, then it's a revision. Secondary, if it's been done for the second time. Tertiary, if it's been done for the third time, so on and so forth.
What is the cost of rhinoplasty?
It's very interesting. Cost varies on the type of rhinoplasty, the surgeon, the location, the country, multiple factors. Out here, will probably start about 75,000 rupees and go up to 5 lakh rupees. And you might also have to stay for about 10 to 12 days if it's a major rhinoplasty, and it's inclusive.
Many patients often ask whether their snoring issue will be resolved following rhinoplasty.
To a certain extent, yes. It's a yes and a no, because snoring has got multiple issues. It could be usual with the jaws. So depending on the reason, there could be some improvement with your breathing and less improvement with your snoring.
Will my breathing improve after rhinoplasty?
I just answered that. Most of the cases, yes, because every single rhinoplasty case, I look into the septum. And if there's a deviation, if some work needs to be done, we do take care of that.
And how many days do the patient have to stay at the hospital?
Absolutely, good question. If you're very nearby us, then we let you go on day 2. If you're far away, you're coming from a different city, a different country, I want you to stay over with us for 5 days, sometimes up to 7 or 9 days. Do contact us before planning your travel schedule.
Is rhinoplasty a daycare procedure?
Only if you do a elaplasty or some small non-surgical or other teeny-weeny type of a procedure. Otherwise, it's not a daycare procedure.
Is rhinoplasty performed under local or general anesthesia?
General anesthesia pretty much all the time. The local anesthesia variant is only when you want to do a little bit elaplasty, nothing more.
So this is for your experience. How many rhinoplasties have you performed so far?
So several thousands in the last decade and two decades almost now.
Alright, many patients wanted to see your before after pictures. Where can they see?
Oh yes, you can see our before after pictures on our website, on Instagram, on YouTube. We sometimes are not that organized to put them up one after the other, but I think if you go through, you'll find hundreds and hundreds and hundreds of them.
Will the lip length be altered after rhinoplasty?
Most of the times no. In certain patients, yes. Please ask us, and if there is going to be a difference, it also depends on the attachment of the antenasal spines. In some patients, it can make a difference, but we'll let you know if it does when you contact us.
Can a genioplasty and a rhinoplasty be done together?
Absolutely. You can do both of these together. It's a very good way, very, very great way to get your facial proportions and facial aesthetics augment at the same time. Chin augmentation plus rhinoplasty can be done at the same time.
Will the nasolabial groove be corrected after rhinoplasty?
Yes, it can be corrected, it can be altered, it can be changed during rhinoplasty.
Will my nose be blocked after rhinoplasty?
We will keep it blocked for a few days, especially when I handle the septum. We keep it blocked for a few days and then we free it up for you. That's called the internal nasal splinting.
Can I go to gym or lift heavy weight after surgery?
So you've got to wait at least for 4 weeks.
Can I go back to work after surgery?
Next day if you're working from home, but otherwise if you have to go out and work, I would think you would need about 10 days off from work if it's an office kind of a job.
Will I get headache after surgery due to radix osteotomy?
You could get headache, but not because of the radix osteotomy, but it's because of the rhinoplasty itself. Some patients can get a temporary transient headache. All goes away in a few days' time.
Will there be any scars on my nose?
A small punch mark, which if you're very careful, and a small line here, which again if you want to go really close and see. Otherwise, no scars at all whatsoever.
How many days of swelling will be persistent?
Usually swelling increases up to 2 days after surgery, and then it slowly comes down. But the swelling lingers around for about a month, which I call as a secondary phase of healing. The first phase of healing is while you're in the hospital, first week. Second phase of healing is about a month. After that, there's still healing happening. Mind you, that happens for a further 4-5 months. But that's a time when others cannot notice the swelling.
How long will it take for total recovery?
Absolutely. Just answered that right now. Maybe 6 months, 3 months to 9 months is what I would say.
And what is a functional rhinoplasty?
Functional rhinoplasty, if you have issues with breathing, a lot of blocked nose, and then you're going to look at what's called as a functional rhinoplasty. Very often I said, we always look at the septum when you do the rhinoplasty, but in a functional rhinoplasty, we can always stick to septoplasty alone and maybe some little tip work too.
Will my insurance cover rhinoplasty surgery?
Very, very common question, yes. So if you're going in for a septoplasty, the insurance does cover because it's a functional issue. Do remember, no cosmetic procedure is covered by any sorts of insurance. And this is like pretty much the worldwide rules. So if it's just a purely cosmetic reshaping of your nose, there is no insurance.
And are septoplasty and rhinoplasty the same?
No, they are not. Just now I was mentioning septum is the bone that's in the middle of your nose. That working on that bone, that is part of bone and cartilage, is septoplasty. But rhinoplasty is rechanging the shape of your nose or changing the shape of your nose.
Can I undergo rhinoplasty if I have hypertension or diabetes?
Yes, you could, as long as it's under control and as long as you get clearance from our physician here and not from our anesthesiologist.
I'm 14 years old. Can I do a rhinoplasty?
Yes, I think only if you're having a major functional issue. Otherwise, a big no. I don't take patients who are less than 16 or 17 for a cosmetic nose job. But if you have a functional issue for whatever reason, then age is no bar. Really, we can do it younger.
I'm 70 years old. Can I do a rhinoplasty?
Yes. Again, you got to get the clearance done from our medical team and from the anesthesiology department. So once they give you both a green signal, we can do rhinoplasty. It's going to be no different than from a patient who's, let's say, 30 or 40.
What is an ethnic rhinoplasty?
Excellent. So ethnic rhinoplasty is to kind of give patients the noses that belong to their faces. So if you are white, then you've got to get a nose like a Caucasian, or if you're an Indian, which part of the country you come from, what are your features? The nose should be made for the face, and that's kind of the idea when you say ethnic rhinoplasty, because in India, you know, you do have people of different races mixed and blended over several centuries, so the features vary, and so it's very important to know how a thick skin nose needs to be handled versus a thin skin nose, and so on and so forth. So I think that's the idea about an ethnic rhinoplasty.
Can rhinoplasty make you look younger?
Yes, of course. It does make you look younger because not only we improve the shape of the nose, but the middle third of the face gets tighter, especially if you're older. We can improve the nasolabial grooves and the lax loose skin on the medial aspect or on this side of the eye. So the entire middle third of the face can look younger, does look younger.
Can my nose be made narrow with rhinoplasty?
Yes, sure. Noses can be made narrower, noses can be made slimmer, noses can be made less broader. All of this is possible. This is what rhinoplasty is about.
Can I get a sharper tip with rhinoplasty?
Sure, we can get you a sharper tip very often. I did mention something about super thick skin, especially when it comes to ethnic rhinoplasty. So we tend to give noses that fit faces, but yes, apart from that, a really sharp nose can be done. We can do that.
Alright, 15 more to go. What are the risks associated with rhinoplasty?
So really no major risk, as I said, if you get clearance and get through the surgery. Apart from some bleeding, you can have some infection and you can have some results that you're not very satisfied about. This is in fact the only main things we ever come across, because sometimes the patient's aspirations or the surgeon's understanding of patient's desires don't match, and then you can have some sort of issues later on. But as a complication, not anything more than this.
How many days the nasal pack has to be retained?
We like to keep the nasal pack for a minimum of 4 days out here.
When will the nasal splint be removed?
Nasal splint removal is after a week. especially when I do the osteotomy. If I do not do the osteotomy, we can take it off earlier, day 3, day 4.
Can we sleep in lateral position? What is the ideal sleep position after rhinoplasty?
So you could sleep on the lateral position. It's not totally contraindicated, but supine is better.
Should I control my sneeze after rhinoplasty?
Yes, if you can. We also give you prescriptions. We give you medications to make sure you don't have running nose and you don't sneeze.
Will my rib regrow after surgery?
Well, no, unfortunately the rib doesn't regrow. We take the cartilage most of the times, but do remember there's going to be no side effects whatsoever after the rib heals. Again, a very common question that asked to us every now and then. So the problems with rib harvest is very minimal. I think in this year alone we've done over 100 rib harvests already. We're just in the 3rd month. It's very safely done. It's a procedure that you don't have to be worried about. Yes, we do a lot of rib harvests, maybe in comparison with another surgeon or a doctor elsewhere in the world who does rhinoplasties. That's also because we do not get to buy ready-made rib here in India.
Can I wash my face after surgery?
Excellent, you can. Absolutely. We do put some tapes. We do put some Dianoplast. So if you cannot get it wet, it'll be nicer, but otherwise you can.
When can I have a headbutt?
So usually headbutt, you can shower your head immediately after rhinoplasty the next day, as long as you don't wet the area under the nose. But a headbutt after a week, I think. And if you're going home, then yes, immediately.
Can the patient remove blood clots from inside the nostril?
Not a good idea. We do not advise this because this can cause bleeding. We do tell them to gently clean when they take bath or use a Q-tip or a earbud, but that's only if they really need. Otherwise, all of these clots just dissolve and go away on their own. You really don't have to do anything with regards to clot inside the nose.
Do I have any diet restriction?
No diet restriction whatsoever. You're free to eat biryani if you want the few hours after surgery. So because it's all in the nose, and so there's no diet restrictions, you can carry on with your normal diet. We do tell you how many hours of fasting you have to be before and after. That's necessary for the surgery. But once you recover, once you're out of that, there's no diet restriction whatsoever.
When can I expect 100% results or recovery after rhinoplasty?
So like I mentioned earlier, very key point, 1 week primary healing, 1 month secondary healing, and the eventual healing can vary. You know, I keep telling this to my patients, 1 + 1 is 2 in math, not always the same with rhinoplasty, not always the same in surgery for that matter. So the healing varies among people to people. You have to understand this, and sometimes we're not in a position to predict this straight away. Yes, we can predict to a certain extent based on the patient's age, based on the procedure we have done, and so on and so forth. But still, as a guideline, I think 3 months to 9 months for the way you want to feel your nose, like how you felt it and how you were comfortable with before surgery. So that's the time frame I like to give.
Is walking allowed after surgery?
Yes, you could walk after surgery.
When will the sutures be removed?
So we do use some removable sutures and some that don't need to be removed. Those that are going to be removed will usually be removed on day 6. Sometimes we ask them to be taken out a little later, in which case we'll advise you. And most of them are getting done here itself.
How many days does it take for the intranasal sutures?
This looks like 100 questions now. How many what?
3 more to go.
How many what?
How many days does it take for intranasal sutures?
So the intranasal sutures are the sutures that you don't see but inside the nose. These are resorbable sutures, generally supposed to dissolve after 4 weeks. But please don't ask us if they don't dissolve in 4 weeks, because sometimes they hang around longer. They just like you too much. And I think a lot of our patients keep texting us saying, "Doc, it's been 3 months and I still feel something coming out from my nose. Looks like a stitch. So I have to be worried?" No. So these sutures are just going to fall off. If they fall off a little later, no worries.
Will there be bruising around the eye?
Yes. You do have bruising, especially if you do osteotomy and especially if you're fair skin. If you're dark skin like me, then probably you don't see the bruising. So bruising is something pretty common. You must anticipate some amount of bruising, especially if an osteotomy is done. But if there's no osteotomy, then bruising is going to be very less.
Okay, last question. How many times do I come for follow-up?
Good question. So if you don't live far away and if you want to see us again and again, you can come back to us for follow-up. But a lot of our patients do travel thousands of miles, hundreds of kilometers. And then what the system we have kept here is, they stay with us on the day 7 or day 8. We do the review, we make sure everything is fine, and then you're good to leave. Because after this, usually healing takes place slowly. There's hardly any risk for infection, and there's usually no risk for any change in shape or any collection of blood or anything of that matter. So one visit here where we are should suffice if you're able to get anywhere between 7 to 10 days for a complete full rhinoplasty or a septorhinoplasty or a septorhinoplasty with rib graft harvest. So that was a quick fire 50 questions on rhinoplasty. She tells me there are more. So I think the next time probably we'll have to do a 100 questionnaire one. But anyway, I hope this was useful. I hope I've given good answers. I think so, which you will be able to use when you are thinking of rhinoplasty, or when you already got one, or when you plan to get one. Thank you and namaste.